And so, we've talked about blood sugar before, kind of just talking about it again. It's the amount of sugar, or also known as glucose, that's in our bloodstream. Things that can change our blood sugar levels, throughout the day, throughout our lifetime, can be the type and the amount of food we eat, the type of, and the amount of drinks we drink, whether it be like soft drinks, juice, water. Again, what time we eat can affect our blood sugars. Physical activity can affect the sugars. Stress levels can also affect your sugars. And then again, being sick can cause your sugars to rise as well. And so again, knowing about these things and how they can affect your body and your sugars is important to know too. And so talking about the benefits of monitoring blood sugar, it can help reach your glucose target goals. Again, we talk about with someone who has diabetes, our target glucose levels we'll talk about here in the next couple of slides to get that answer question too. And then also prevent or detect very high blood sugars, also known as hyperglycemia. And if your sugars are really high, sometimes it can require you to go to the hospital again to get those sugars where they need to be. Another thing is prevent or detect very low blood sugars, and this one's known as hypoglycemia. And again, if the sugars are too low and you aren't able to get them up, you may have to go to the hospital too. And so another one, learn how food affects your glucose levels. And so, again, kind of like we discussed in the first slides, monitoring our glucose throughout the day can kind of help us know how that food that we just ate affects our bodies, and whether, how did it make me feel good? Should I eat that again? Kind of thing too. Learn how activity affects your glucose levels. Physical activity can cause your sugars to drop. And so knowing what your sugars look like when you're participating in physical activity can be important as well. So you're not, your sugars aren't dropping too low and too quickly either. And so if you take insulin, knowing how much insulin to take is super important. Again, talking to your provider about that and knowing those amounts of insulin you're taking. Know if any changes need to be made to your medication. Again, communicating with your provider. A good way to know if you need to change medication could be keeping that blood sugar log and seeing if your sugars are dropping too low. Sometimes a doctor may need to change your medication, or if your sugars are continuing to be high, again, making those changes. And so an analogy for monitoring blood sugar comes from like driving a car. And so when we're driving a car, the operator uses the monitors to determine the next step. The instrument panel, kind of like we have depicted up here, tells the driver how fast they are going, your fuel gauge, and if something needs attention, such as like the check engine light. If the driver goes above the speed limit, they step on the brake, and if they need to speed up, you can press on the accelerator or the gas pedal. If the gas gauge is too low, the driver should stop at the gas station to refuel. This is kind of like an analogy with your sugars. If your sugars are too low, it might be time to have a snack or eat a meal. If the engine light comes on, the driver looks under the hood and tries to correct the issue or get help from a mechanic if needed. Again, looking at your sugars or other like blood tests, again, too, if something doesn't look right, referring to your doctor. And without these instruments, the driver may get a ticket for speeding, running out of gas, or even damage the engine. Super similar to our bodies. Again, if we're not managing our sugars well, it can cause other effects, such as damage to our bodies too. Does anyone have any questions so far before I move on? All right. And so, let's see. Again, driving a car is like managing diabetes, like I've talked about before. Um, without glucose monitoring, like driving without these instruments. So the lack of information and not taking corrective actions may cause serious health problems. Like we've discussed in previous classes, reducing risks for things such as, kidney disease, prevention of diabetic retinopathy in the eyes, again, neuropathy, loss of sensation, and throughout our body from our nerves. And so, if you feel sick or ill, you can check your blood sugar to see if it might be the cause. If your glucose is above target, you can take the steps to lower it. Again, if your glucose is below target, you can take those steps to help raise it. And we'll talk more about that too in these slides. And again, if these steps do not work, then you will probably either need to seek medical attention, whether it be from your provider, or if your sugars are really high or really low, again, go to the hospital or the ER. And so, again, we've talked about these kind of before, and I mentioned our target glucose levels are the healthy blood sugar ranges for people with diabetes. And so someone with diabetes this is going to be like our sugar level range before meals. We want to be between an 80 and a 130. Again, when you wake up in the morning before you eat breakfast, that's probably what it's going to look like around there. Or if you ate a meal and it's been a couple of hours, that's probably the number we're going to shoot for too then. And so about 1 to 2 hours after your meal, we want our sugars to be below 180, just so that we're not allowing them to get too high, because anything above 180 can be dangerous too. So any questions? Alright. Again, we'll talk more about how to check your blood sugar. I also have a video and a couple of sites here we'll watch too. But again, a glucose meter or glucometer, many of us will have this prescribed to us from the doctor. Like we'll get like our Lancet, which is this little guy here, the needle. We'll get the glucometer, the device here, and then the test strips as well. And so these typically, again, like I said, will be provided from your provider. And then it's going to depend on like the amounts of Lancets and test strips. Again, depending on like your insurance as well too. And so again, how do we check our blood sugars? Here's a little photo with what we can see. It's important to wash your hands with soap and water, or use like an alcohol wipe on the area you're going to poke. Turn the glucometer on and insert that test strip. Use the lancet to prick the side of your finger and collect a small drop of blood on the test strip. Wait for the glucometer to display your blood sugar readings. And then if you want to keep a log at home, you can go online, you can find printouts of like sugar logs, as well as like sugar and food logs. So you can kind of document that together. As well as there's apps online, MyFitnessPal is a common one that people use. And yeah, you can track that in there too. And so again, it can be important to like track your numbers from previous blood sugar readings, bring it back with your doctor and discuss them too. And so we have some tips with the glucometer. Again, quality check. If you have a glucometer, it's important to do these, the control testing to make sure it's working properly. It's important to do a control test whenever a new container of test strips is open, to make sure that the control solution and the test strips are matching up on like what the level should be for that control solution. It should say on, I believe on the test strips, typically like the ones that we use here, say what level those need to be in and what range it looks like depending on that control solution. And so when blood glucose results are unusual and do not match how the person typically either reads or how they're feeling, you should also do a control test to make sure that your glucometer is reading correctly too. And so some more tips. Again, storing supplies. It's important to take these notes, check the expiration date on the test strip containers, make sure they're not expired. You can write the expiration date like on the outside or on the box so that you can see it easily or highlight it. Keep the strips in a dry place so they're not getting wet. And these, because that can affect how it tests too. And so, again, avoiding storing in humid places like the bathroom where someone has just taken a shower can affect like these test strips negatively. And so also keeping the cap tightly closed will help keep that moisture out. Never expose the strips or your meter to extreme temperatures, like keeping it in a parked car. Sometimes it can get really cold or really hot depending on the time of the year where we're at. And so that can affect how our glucometer works too. And so getting a good blood sample, again, it's, following these steps, washing your hands with warm water or using an alcohol wipe to clean your fingertip is important to prevent any like bacteria or stuff like that we might have on our hands from infecting that spot. And so a good way to help get your blood flowing to your fingers so you can get a good blood sample is shaking your hands to force the blood to the fingertips. Again, holding your hands down to your side for 30 seconds or longer if needed. Again, like rubbing your fingers together can help get that blood flow to the fingers as well if you have trouble getting blood out when you take these the pricks. And so instead of poking the fingertip, you can try poking the side of your finger. When we do these here, typically we do the side as well. It's less painful too. Again, gently rubbing that finger towards the fingertip to encourage blood flow is going to help get a good drop for the meter too. Yeah. And so, again, it's super important to dispose of your lancets and test strips effectively because they have your blood on it. We don't want to get poked again by the lancet, or you don't want anyone else to get poked by it. And so having a biohazard container for your sharps, or if you don't have one, an easy one you can do if you have a detergent bottle at home, an empty one, labeling it sharps do not recycle can be another easy way to dispose of your lancets and your test strips. So you're not just throwing it into the garbage, and you can prevent anyone from getting hurt from the sharps. And so, don't put it in the garbage or the recycle too. Oh, and then I believe another good one you can use are like bleach bottles. Anything that's like has that like thick or double lining in the plastic. Again, I've kind of talked about recording your results on what your glucose looks like on that day or the time. And so here's like an example of like a little sheet that you could use. You can always go online and find like printable ones, or like I mentioned before, the apps. But on this one here, we can see the breakfast, lunch, dinner, before bedtime. Sometimes ones have snacks. Others will have like where you can record your food. And so if you want to do that too, you can put that in the notes area. But again, I'm noting what food you just ate with what your blood sugar looks like before and after can help you get a better idea of how that food affects you and it can also help you get a better hold on managing again those sugars too. And so, um, again, and some more tips for our glucometers. Recording your results. It can give you the bigger picture of any patterns or trends in your blood sugars, like I just mentioned. Again, think about possible causes for changes in your sugars, whether that be from the food you just ate, if you did some physical activity, or you might be under some stress, and that can also affect your sugars too. And so check to see if your numbers are in target range. Like we mentioned back again, let me go back to those slides. Our target range, again, before meals, 80 to 130, and after below 180. So, also learn to use your blood sugar numbers to make eating and physical activity changes to help your numbers and target range, like I mentioned. Stay in that goal, try and maintain the 80 to 30 or anything less than 180 after that 1 to 2 hours after your meal. It's super important to help reduce those risks too. And so, again, when should I check my blood sugar? Talking to your provider, that's going to be your best start, seeing what they would like you to do and what they recommend. Um, how many times and when you should be testing each day, or if you should be testing each day. Sometimes, if you are really well managed, sometimes you won't have to test every day too. But again, check your blood sugar at scheduled times as needed if you want to do it at lunch or breakfast, lunch, and dinner, or maybe just once a day too. Again, not everyone will have the same schedule. So, refer to your provider and what they recommend too. And then here's like some common times people will take theirs. So we kind of referred to this as fasting, the period when we're asleep from that time we go to bed and then we wake up. And so that's a good time to check our sugars. And then before a meal, 2 hours after your meal to see how that food kind of affected you too. If you'd like to at bedtime. Another one when you're sick or stressed out, again, those affect your sugars. So making sure that nothing's out of the normal. When you have symptoms of high or low blood sugar, again, I'll talk a little bit more about that here in these next slides, what that looks like. And then, like I've talked about, after physical activity, because that again can lower your blood sugar. And so interpreting your blood sugar levels. If your blood sugar is too low, something we can do to help is try eating 15 grams of carbohydrate snack, whether that be a fruit or a glass of juice. You can wait 15 minutes before checking your blood sugar again, and then go ahead and check it and see if it has improved. If your blood sugar is too high, you can try going on a walk or do any other type of physical activity again. Make sure you have taken your medications or insulin. That could be another reason to check to see if you're stressed about anything. If you are, try doing something to relax. Take a couple deep breaths. That's always a really good place to start. Go for a walk too. That can always help. And so, again, we talk about those levels before a meal, 80 to 130. And then after our meals, we want to be less than 180 to maintain a good sugar level. And so with hypoglycemia, this means low blood sugar. If our blood sugar level is reading below 70, then this is going to be considered hypoglycemia. And some common signs and symptoms of this is going to be like a nervous feeling, you might have trouble concentrating, you could feel nausea, tingling in your feet or hands, just kind of like anxious or not feeling super well. Um, this can happen after physical activity. Again, if we're doing everything as we should, sometimes that physical activity can lower our sugars too much and we can feel that. If we're skipping meals or not eating snacks, or not eating enough throughout the day, that can also cause low blood sugar. Taking too much medication or insulin can also cause your sugars to drop. Again, like I mentioned, recording your sugars and taking it to your doctor, and looking those over too to make sure you're taking enough medication or vice versa. And another one can be like drinking alcohol without food or drinking alcohol in general too can lower that blood sugar, make you feel icky. And so, avoiding that too can be good. And so, ways we can treat our low blood sugar, if so, if you're experiencing any of these symptoms related to diabetes, it is recommended to check your blood sugar levels as soon as possible. Again, if your blood sugar is below the target, anything below that 70, you probably want to eat around, or you're going to want to consume 15 grams of fast-acting carbohydrates as soon as possible. And some examples of these look like fruit juice, a cup, fruits like a banana, grapes, oranges. For like the grapes, it would be maybe like a cupful. Some honey that can also help. Hard candy or jelly beans, sports drinks, white bread, bagels, and other refined things made out of like those grains, like the bread. Eating like a slice of bread can help too. And like crackers or pretzels, having a couple of those can help bring your sugars back up too. And so once you've ate something or drank something with the sugars or the carbohydrates, you want to wait 15 minutes and then check your blood sugar again. If it's still below the target, go ahead and eat a little bit more or drink a little bit more, and then repeat. And if your sugars are within the target range, you don't need to drink or eat any more of that snack, and then just continue to monitor your symptoms and blood sugar as needed too. If you notice symptoms but can't check your blood sugar, then you should go ahead and have that little snack too, just to be sure, and make sure that your sugars aren't going to drop too low too. All right. Does anyone have any questions before I continue? All right, if not, that's okay. All right, so hyperglycemia, or high blood sugar. So levels reading over 250 or more can be pretty dangerous to our bodies. And so again, discuss your blood sugar goals with your provider. Again, that range anywhere between the 80 to 130 is your normal, and then anything below the 180 is a good place to start. Some causes of high blood sugar, again, medications, if we're not taking them or if we're not taking it enough, that can cause our sugars to continue to be high. Again, eating too many carbohydrates can cause the sugars to rise too. Not getting enough like vegetables and fibers and different things like that. Weight gain can cause our sugars to continue to stay high. Again, like we've discussed, being sick or having some sort of infection can make it difficult for your body and cause those high blood sugars too. Again, not checking your blood sugar levels regularly. If you don't know what your sugars look like, it can be difficult to kind of know if your sugar is high or not in that moment too. And so again, doing it as needed or finding that set schedule to check your sugars is important too. And so, again, some signs and symptoms are super similar to those of diabetes. Again, frequent urination, increased thirst, increased hunger, feeling tired. Um, you can also feel that like that weight loss, the blurred vision, slow healing again, and the numbness and tingling in your feet and hands can be due to that hyperglycemia. So, um, in order to treat our hyperglycemia, if you experience any of these symptoms, it is recommended to check your blood sugar levels as soon as possible. Some tips that can help you to reduce your sugar levels. You can engage in physical activity, again, walking, running, using stationary bikes or whatever you have available to you at home. Um, just again, monitoring that, drinking plenty of water, staying hydrated is going to help too. Again, taking your medication, insulin as prescribed, can help you maintain those normal blood sugar levels. If you notice your blood sugar levels are staying high and aren't coming down for a long time, make sure to talk to your healthcare provider. Go over those things. It can be super important for them to know because it can be um, pretty dangerous for you if you're not maintaining those levels at a normal or normal side. And so, some problem solving, like managing on our sick days. Again, being sick can increase your blood sugar levels as well as being stressed. Um, again, this gives you more chance of being dehydrated. Drinking lots of water, sugar-free fluids is going to help you prevent that dehydration. Um, again, check your blood sugar often as needed if you're sick too, because we know that it can affect our sugars. And then having one serving of carbohydrates every hour as needed can also help us maintain those sugars again, because feeling that sick can throw our sugars off being sick or being ill. And so it's important to notate these. You need to contact your provider if you're feeling any of these symptoms have or are experiencing any of these. Again, if you're vomiting for more than 1 day, diarrhea more than 5 times or longer than 6 hours. Um, again, like that dehydration, high fever, either at like a 1.1.5 or above, definitely need to see a doctor. If you're having trouble breathing or if you're breathing too fast, hyperventilating. Again, if your sugars are over 300, if your blood sugar is over 400, it's recommended that you go to the ER immediately. It can be very dangerous for you to have your sugars that high. Um, again, if you're experiencing abdominal pain or other unusual pain, sickness for more than 2 days, that can also consider you to go to the doctor or contact your provider. So, moving on. Talking more about problem solving again, when it comes to these different things, managing diabetes requires actively addressing potential issues and challenges we face on the daily. However, there may be many different aspects of diabetes care that require our attention, making it overwhelming to address them all at once. And so, again, making that plan can help make it less overwhelming. You can start, um, it is helpful to focus on one area that you find challenging in that moment. Again, pinpointing where you want to start can be make it a little bit easier too. Consider a challenge that you feel ready and capable addressing at that time too, so you know that you're motivated to do it as well. One helpful approach is to use, again, the problem solving to develop a behavior change, taking those steps to think it through, and figure out what you can do to help problem solve. And then we'll talk about method here in the next slide. This one's called the SOAR method. It's an acronym that stands for set goals, SOAR options, arrive at a plan, and reaffirm commitment. And so, setting those goals, looking at what you need to accomplish, what again, sorting options, which one, which one do you want to do first? Come create that plan, how you want to start, and then reaffirm the commitment. Make sure that's actually what you really want to do too. And so, again, set the goal in general terms. Sit down, describe the problem, be as specific as you can. An example would look like, I can't remember to take my medication. That, you know, that's a good start, but it's too vague, it's not specific enough. And so it's important to try and get down to the root of the problem. And so, ask yourself, when do you forget to take your meds? What do you think makes you forget to take them? And so, reflecting, when do you forget to take your meds? It might be like in the morning, you're super busy. And so, putting them where you're going to see it on your way out or something like that. What do you think makes you forget to take them? Again, you're busy, you don't see it immediately. Get more specific. And again, this is going to be a little bit of a better goal. So I do pretty well remembering the morning meds. It's the medicine before dinner that I kept forgetting. I'm so busy getting dinner ready that it just slips my mind every time. Again, looking at what's going on, what's the problem, can help you start and remember again, like take your medications at the time needed. And so number 2 is sorting the options. So to start addressing a behavior that you wish to change, again, begin by brainstorming possible solutions. Examples look like keep a bottle of medication where you usually have dinner, like in the previous example. So putting that where they're going to see it. Set a reminder on your phone for the time you need to take your medications. Again, putting that alarm for your medicine can be super easy. If you don't want to do that on your phone, you can always purchase an alarm specific for your medications. If it makes it easier, put a note on your in your kitchen, on the refrigerator, maybe in your car, in your bathroom, on the mirror, just somewhere where you're gonna see it to help you remember. Plan dinner in advance to make it less stressful. Again, meal prepping or buying the groceries in advance too can help make that less stressful in the evening as well. And so 3, arrive at a plan in specific terms. Think of all the steps involved in enacting the plan and then think of the potential barriers to successfully carrying out these plans. Again, thinking through, how am I going to do this? What it will look like? What will you do first? What are the specific steps you need to take to do these things? Describe a potential reminder method. Again, like we talked about the alarm, the notes, and different things like that. And so number 4, reaffirm commitment. Write the steps down that you need to accomplish this behavior so you can see what you need to do. Consider your thoughts, feelings, and attitude that come with the problems you're trying to fix. It can be difficult. And so I know, like, in some circumstances, with difficult situations, you want to avoid those things. But with these kinds of things, we don't, we need to like recognize them and try to do our best too. And so again, recognize the negative self-talk. If we talk down on ourselves, we need to try to work to change that to be positive self-talk. Motivate yourself too. It's super important. And celebrating the little things. whether that be our sugars levels coming down a little bit, some weight loss, change in diet, adding physical activity, all of that can, definitely celebrate it. And then remember that each step, no matter how small, takes you in the right direction towards managing your diabetes. Again, just making those small changes at a time will help benefit you in the long run too. But yeah. So we'll have 2 questions here. If anyone would like to answer too in the again in the chat or unmute yourself. But again, so your blood sugar before breakfast is usually in the normal range. But most days your blood sugar 2 hours after you eat breakfast is above the target range. What do you think is causing your blood sugar to be higher after breakfast? Does anyone have any ideas of what could be affecting this person's blood sugar?
I think it depends on what they're eating, like maybe white bread or toast, bagel, something like that.
Yeah. And like it's okay to have a little bit here and there, but if you're having too much of those carbohydrates, yeah, definitely that can be something that can affect us. You pretty much answered that spot on. Too much carbs during that breakfast time. Another one, not taking enough insulin, or your medicine also can affect what your sugars are looking like at that time too. But yeah, thank you for answering. Next one. What would you do? Again, your blood sugar before dinner is usually above your target range. You know that eating dinner will make it go up even more. What could you do to limit the rise in blood sugar before you eat dinner? Does anyone have any ideas what you might be able to do before having dinner if your sugars are a little bit high at the time? Drink more
Exercise.
water? Yeah, drinking water could be one. Did you want to say something, Adeline? Sorry.
I said exercise.
Oh, exercise.
Take
Sorry. Okay.
long.
But yeah, drinking water, exercising, exactly. Increase your physical activity, whether that be in the afternoon before dinner. Definitely. Thank you, Adeline and Shauna. Um, Again, check your blood sugar before bedtime. Maybe change the amount of carbs you're eating during lunch, or if you're having an afternoon snack, limiting those amount of carbs so that you can lower your or keep your sugars at a more normal range, in order to, allow you to eat that dinner. Or, we'll go on a walk beforehand too. That can also help lower those sugars. But yeah, thank you for everyone who answered. We're getting pretty much towards the end of today's presentation. For this last slide here, again, remember that you are in control of your own story, your own body, your life. Again, many diabetes complications are preventable and can be delayed by doing a lot of the steps and things we've talked about over these past few weeks, like blood sugar monitoring, eating healthy, participating in physical activity, taking our medications, limiting and stopping the amount of if we're smoking tobacco or consuming alcohol, limiting that too. Having a positive and hopeful outlook on your life, on again, managing your diabetes can definitely make it a lot easier. And so I just wanted to say thank you all who have been participating with us and for all your participation throughout these couple of weeks too. And then again, I have attendance taken for everyone that was here these past couple of weeks. And so you'll receive an email from me with more information on how to receive that blender. As well as on that email, we'll have a post survey. And so when you fill out that post survey, that's gonna, you'll get the information for that blender too. And so, yeah, and then I also have one more thing. I can also send this in the email about the post survey, starting in March. For this is it's called Strong Spirit, Strong